Hi, Kinesiology students. My name is Robin Andrade, and I am the founder of PatientPro. Welcome to the platform, and here's a video to help guide you through the first few steps of how to engage with a patient. So you have been provided with a username and password from your lab instructor. Mine looks very different than the ones that you've been given, but from here you're just going to hit sign in after you enter that username and password. There's a few things on the screen here. You'll see the AI-powered diagnostics, case library, and performance analytics. What we're going to focus on is the AI-powered diagnostics space. And you'll also see a system status at the bottom. This is just letting us know that every application we are utilizing within PatientPro is working properly. So you don't need to worry about that. We're just looking at those green check marks, and it looks like it's all systems go. From here, I'm going to hit the Start Diagnosis button. I know that kinesiology students are not providing a diagnosis. You can look at this button as a Start Interaction button. So from here, I'm going to hit Start. And you'll see a case library pop up with two different kinesiology cases. They're both beginner cases, and they have a little bit of a stem. And a stem is just providing you some details about the patients and what is going on in their life and what brings them to you today. So you'll see there's a select clinical field here that says kinesiology, and the other option is pharmacy. But of course, today we are just focusing on kinesiology. You can leave the pharmacy button untouched. So again, we're going to hit Start Diagnosis, which is Start Interaction. And here we go. So on this screen, we have a few things that I'd like to review quickly. You have a diagnosis tracker. You can also look at this as a progress tracker. It just shows your overview and making sure that it's counting all of the points that are included in the rubric. This might be a little slow right now. We're working on some updates to improve it, but you'll see if you click on the rubric button, everything that your lab instructor is looking for you to ask is included in the rubric, and there are also points assigned to it. So we have points scored, total points, and a percentage. Again, if you finish your interaction with the patient and all of your points have not added up yet, it will catch up. It just takes a little bit of time. So from here, also there's a hide tracker, so you don't have to use it if you don't want, and you can make the screen a little bit bigger. If you just find it frustrating to see that tracker going off while you're talking, you can go ahead and hide it. And on the right-hand side, you'll see a little bit more information about the patient. So the case that's been loaded is a body composition case study. The patient is a 37-year-old female accountant, and you can begin your diagnostic interview using the kinesiology framework. So to start the discussion, you're going to hit Start Diagnosis. And if you also would rather chat with the AI platform, you can do that as well. So I'm going to verbalize my conversation. I'm just going to go through a couple questions with the patient so you can see an idea of how it works. It just takes a couple seconds for it to load. Hi there, my name is Robin. How are you?
Hi, Robin. I'm doing okay, thanks.
Is it okay if I ask you a few questions today about your health?
Okay, so, yes, that's fine.
Excellent. So I'm going to stop there. You will find that the AI might say, okay, so, or well. These are usually just filler words to fill up any uncomfortable silences that might occur during the process or the engagement of your interview. So you can just ignore them for now. It's just like just trying to give a little bit more nuances to the conversations. So you can see that the progress tracker is already at 5% because I've asked a couple things, and you'll see down here that I've had a point awarded for gaining the client consent to proceed, which was attached to your rubric item. So introducing self-enroll, and then down here, you'll see the check mark of gain client consent to proceed. So you might want to familiarize yourself with the rubric before you engage with the platform. It's really up to you. Please engage with this however you would like to. It's here for your practice, and I can't wait to hear what everybody thinks.